Hi there, Dr. Hizon, here to talk about headaches and documenting for that. So as a disclaimer, please refer to your particular doctor. This is a general course not intended to be medical treatment, and your particular situation may vary. Symptoms of headache are very common. Nausea, vomiting, photophobia. You can have dizziness, lightheadedness, tight sensation to the head, as well as a previous history in the past of having headaches. Usually we'll do a physical exam with vital signs, especially blood pressure, eyes, ears, nose, and throat, neck, and neurologic examination. Testing will look at history, physical labs, as well as maybe other modalities, even neck x-rays, because sometimes headaches can come from the neck, as well as other things such as ultrasounds, sinus x-rays, MRIs, and EEGs. The treatment could be over-the-counter medications. You could do rest, hydration, you could do headache medications, and it really depends on what the provider wants to do. There's lifestyle medication modifications. For example, if you get headaches when you drink alcohol, maybe you don't drink alcohol, those sorts of things. Get adequate rest. We may talk about different medications. Some of these are the migraine headache type medications, and we may need to be monitoring them. And on the lifestyle modifications, again, we talk about even a headache diary we'll ask them to do. Medications might be prescribed. So in documenting for the patient with headache, typically a chief complaint might start off as headache with symptoms of this, like say photophobia, for how long, how many days. So Mr. Jones is a 22-year-old male, presents today for complaint of headaches for 4 days. The onset was yesterday, or actually 4 days ago, whatever that date was. And you could say that it was sudden, and then has he had any past medical, these sort of problems. And is the headache on a scale of 0 to 10, with 10 being the worst pain, what kind of pain would they have at rest, and what kind of pain with activity? And are there any other symptoms, such as does he have photophobia, or ability not to want to be around lights? Does loud noise make it worse? Does smells make it worse? And then, is this intermittent? Is it one-sided or both-sided? And provocation, what makes it worse? And alleviation, what makes it better? And then are there other symptoms and signs? So these are kind of templates you would go through. Do they have a history of elevated blood pressure in the past? Have they had recent surgeries or procedures? What's their previous treatment so far? Have they had medications? What's their previous workup? Have they had physical exam, labs, daily blood pressure checks? And have they seen specialists such as neurologists in the past? And then usually we'll do a past medical family social history, checking for tobacco use, might be other drugs, exercise, nutrition, sleep, look for constitutional symptoms, have they gained or lost any weight since the last visit, and then the usual review of systems. And then on the objective, we'll give a general overview of how the patient's doing. Are they in mild, moderate, severe distress? And then on the HENT, are they tenderness to palpation, say to the temporal area? How is their visual acuity? OU means both eyes. Are their pupils equal round, reactive to light? Or do they have irritated sclera, which is the white part of their eyes? And you'll go through your template and see if that's exactly what your provider wants to document. Cardiovascular, which is usually the heart. Pulmonary is the lungs, as well as the abdomen. And then neurologically is going to be where they spend a lot of their energies looking, and they may be checking for their memory. They're going to check for the cranial nerves, motor strength. Do they have sensation to, say, vibratory, pain, light, touch? They might do cerebellar type tests, and quite a few other neurologic tests. So on the assessment and plan, is this a simple or complicated case? Does it require straightforward or complex decision making? And this, in the MDM, the medical decision making, is when they will give you rationale and reasons for how they're treating this. A typical ICD-10 code could be R51, which is for headache, or it could be G44.89, other headache syndromes. Plan and treatment could be lifestyle modification, prescribe the medications, might be blood pressure checks, might be follow-up with your primary care physician, or with a specialist like a neurologist. So in terms of pearls and pitfalls, be sure to get the correct affected side of the patient if they're talking about where their head pain is. Be sure to document all previous treatments and past medical history and family history of headaches. Learn the various questions and physical exam tests that might be asked. And please ask your doctor if you have questions about the evaluation of the patient with headache in terms of documentation. And in primary care, be sure to ask about and document quality measures, which are prevention. Takeaway points are headaches are very common. Treatment depends on the type of headache. Diagnosis depends on accurate past medical history, history of the present illness, and evaluation. There usually are previous episodes of headaches. It's important to determine what the patient has previously done and if those attempts have worked. A lot of times what we're going to be worried about is, does the patient have brain cancer? And there may be special tests for that. So be really careful to document for those by your provider. So study hard to learn the various questions to ask, such as the accurate past medical history and history of the present illness. Learn how to perform a neurologic exam to assist the provider in terms of documenting for that. And again, we appreciate all that you do, because while doctors save lives, medical informatics specialists and scribes save doctors. Thank you.